Okay. I'm Sherelle Johnson, and I'm performing my physical assessment. Before I have come in the room, I have washed my hands, I've closed the curtain, I've introduced myself to my patient. This is a 16-year-old male who looks appropriate for his age. He is well nourished, no obvious signs of deformity. He walked in with normal gait without assistive devices. He can get up and down from the seated position with no help. His affect and mood are appropriate. He's pleasant and relaxed. His clothes are appropriate for the evaluation. Now, could you please tell me your name?
Nicholas Johnson.
What year is it now?
2015.
And what is your date of birth?
11/8/99.
And where are we right now?
9415 Lester Lane.
So as you see, he is alert and oriented times 3. So I'm going to begin my assessment checking his skin. I'm going to look at his hands and his nails. His fingernails are clean. He doesn't have any lesions on his hands. His skin is warm and moist. Checking his turgor. He's got excellent turgor. Moving on, I'm going to be assessing his skin throughout the assessment. I'm going to start checking his scalp. First, I'm going to don my gloves. And I'm going to be checking his scalp to see if he has any lesions. Make sure there's no infestation. Looking for lumps or bumps, anything like that. His hair appears to be clean. There is no infestation. There is no lumps or bumps or lesions. His facial symmetry, looking at his face, he's symmetric. He smiled for me. Puff your cheeks. Stick out your tongue. All right. I'm going to look at his eyes. His eyes are even on his face. They are symmetrical. They're level and even with his ears. Just going to take a quick look at his pupils. Look straight ahead at the wall for me. All right. His pupils are equal and reactive to the light, and they are 3 millimeter in size. There is no evidence of any drainage from the eyes. Just palpating his lacrimal ducts here, also his sinuses. That all feels well. Now I'm going to be checking his mouth, so I'm going to don on some gloves again. And I'm going to be checking his membranes, making sure he's moist and pink, checking his teeth, checking his gums. So I'm going to ask him to open up wide. I'm going to use my tongue depressor to hold his tongue down. I'm going to use my gauze to palpate. I'm also going to use my light that I should have left out on my bedside table to look, say ah, and he has no tonsils. His tonsils have been removed. Nice pink moist membranes. Put your tongue back in. All right. Now from here we are going to check his face. So this is where he should puff out his cheeks as he did earlier. Can you also lift your eyebrows? Face is symmetrical in movement, and he has no lesions on his face. He has a little bit of scarring from maybe some acne. Now we're going to do his lymphatics. I'm going to palpate for his pre-auricular lymph nodes and then the post auricular to the occipital to the tonsillar, the submandible and the submental, and then the cervical chains, as well as the supraclavicular. Can you take your shirt off for me so I can? Okay. So I'm going to check the supraclavicular. Put your arms for me. The axillary nodes. Go ahead and lay back for me. I'm going to check his inguinal nodes. I feel no swelling in any of them. I'm going to provide some comfort for him by covering him while I examine his chest. His chest is symmetrical. He has no open lesions. He rises and falls symmetrically. Put your arms down by your side. And let's see. He's in a relaxed position. Actually, let me get you to sit up. And just sit to the side just a little. Twist your body. A little bit more. And I'm going to listen to him. I'm going to take a deep breath for me. Looking for symmetry. Very good. And then I'm going to percuss. So relax your arms to your side. Going from each side by side. All right. Now I'm going to listen to the front of him. All right, I'm sorry, I'm going to continue listening to the back of him first while he's sitting this way. Deep breath for me. Deep breath. 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 One more. Very good. Now I'm just going to have you turn to the front a little bit here, and I'm going to check the front of his chest. Again, looking for symmetry. Deep breath for me. And his chest rises and falls with symmetry. Again, no lesions noted, so I'm going to listen to him in the front. Deep breath. And I should start from the left and work my way to the right. All right, and now I'm going to have him lay down so I can listen to his heart. Go ahead and lay back. Can you turn? Go ahead and turn this way for me. Lay on this side of the. Of course, if I was in a clinical setting, I'd have better access all the way around. Slide back this way a little bit. Put your head more towards this side of the bed. There we go. So now I'm going to palpate the palm of my hand. And then I'm going to listen to him. And I'm going to listen to in the aortic at the second right intercostal space. I'm going to listen to pulmonic at the second left intercostal space. Tricuspid at the left lower sternal. And mitral at the fifth intercostal space, mid-clavicular. Nice regular rhythm, no irregular beats. Now I'm going to check his capillary refill, and we want him to be less than 3 seconds. And it is, it's less than 2 seconds. I'm going to feel for his pulses while he's lying down. We'll check his carotids. We'll check his radial pulses. Checking them bilaterally. Make sure they're equal. And his brachial. I'm just going to pull his covers down here a little bit in the femoral. Nice strong pulses. The dorsalis pedis. Unfold your legs for me. And then popliteal. Very good, nice strong pulses, equal bilaterally. Now I'm going to check his abdomen. I'm going to first listen. I'm going to look, listen, then feel. So again, I'm looking. I see no abnormalities, just a few freckles. I'm going to start by listening to his bowel sounds. And if I did not hear a sound, I would listen for 5 full minutes in each quadrant until I did hear a sound. And he has excellent bowel sounds. Dinner must be coming on out. He has no obvious herniated belly button. And I'm just going to do light palpation. Are you having any pain? And then I'm going to do deeper palpation. I feel no obvious signs of any problems. Right? Go ahead and let's sit up and dangle your feet over the side of the bed. And now again, I'm just going to give him a general overview of his musculoskeletal system. His joints, I'm going to check his range of motion in his joints, which appears to be normal and equal. Squeeze my fingers, pull me towards you, push me away, right? And then let's take your, and checking his legs. I'm going to push against me, there we go, pull. Push against me, and then pull. Right. I do not have a reflex hammer, but if I did, I would test his reflexes by resting his arm in mine, and I would tap in the joint of his elbow, assessing for those deep tendon reflexes. And then I would do the same in his knee, assessing for the deep tendon reflexes. But I do not have a hammer. So now we're going to go through a series of neuro tests. We're going to do the finger to nose. So we have you stand and close your eyes and then reach your arm straight out as your T. in a T formation, and carefully bring your finger, touch the tip of your nose one at a time. All right. And then the other one. Very good. Now, put your arms to your side. Put your feet together. Now close your eyes. We're checking the Romberg test, looking for any swaying or deviation. And we're going to watch him for 20 seconds. All right. And next I'll have you lay back down. Go ahead and lay with your head this way. And stretch yourself out all the way. And we're going to do the heel to shin test. So if you could bend your knee, this knee, and rub your heel down your shin, straight down. And then do it with the other leg as well. Very good. Okay, go ahead and sit up here on the side. One test that I forgot to do early on, the whisper test, when I was assessing his hearing. I will do that now since I realized that I did not do it earlier. I'm going to first check the tragus. Is this any tenderness here when I push? Okay. I'm going to close the opposite ear and whisper 2 letters and a number to him to see if he can recall those to me. Did you hear me? What did I say?
A1A.
Very good. And then I'm going to do the same thing to this ear. B2B. Did you hear me?
Mm-hmm.
What did I say?
B2B.
Very good. So he got all 6 letters and numbers. And this concludes our physical assessment.